I have to say that when I woke up this morning and at about 10 of 5 this morning, saw on my phone that Pfizer had an announcement about the results of this trial, I broke into a big smile. It's only a press release. And as you know, we always want to see the data and we're a little bit cautious till we see the full data. But what Pfizer announced is nothing short of great news for children and for controlling the epidemic. They announced that in a study of about 2,230 children, their vaccine was 100% effective based on small numbers, but 18 cases in the placebo recipients and none in the vaccine recipients. More importantly, they announced that the side effects were pretty much identical to what had been seen in older patients, in young adults and older adults. So there were no serious problems seen. And that the antibody responses, particularly those that involved neutralizing antibodies, those antibodies that we think are most protective against COVID-19, were higher in children than in these teenagers than they were in adults. So kind of a 3 for 3 on good news. They announced that they plan to submit these data to the FDA. The FDA will review them, and we can expect that it's likely that they'll get expanded emergency use authorization so that we can begin vaccinating children 12 to 15 as well as those 16 and up. And all told, this is really important news. It's important news for 3 reasons at least. The first is that it protects children. That's the most important reason. We often say children don't get sick as often as adults and that there are not as many hospitalizations or serious outcomes, but that's damning with faint praise. To date, there have been something over 300 deaths from COVID-19 and MISC, the complication of COVID-19 that children experience. There have been hundreds of thousands of hospitalizations. There have been probably millions of days lost from school. And there are children who are suffering long-term effects, the so-called long COVID. So we want to protect them from that. That's the first reason. And I want to emphasize that I think that's the most important reason. The second reason is that we know that teenagers in particular are important spreaders of infection, and that having them be able to be vaccinated will allow them to interact with vulnerable people who can't be vaccinated or in whom the vaccines won't work, and will decrease the risk to their family members and loved ones, because no vaccine is 100% effective, and just because grandma and grandpa have been vaccinated, this adds an important extra layer of protection. And the third reason, which is really, really critical as well, is that we're not going to get to herd immunity without vaccinating children. In the US, 23% of the population is under 18. In Utah, that's closer to 29%. And so as long as vaccine was restricted to adults, we were just not in a position to fully control this pandemic. Now we have an important tool that will help us get where we need to get to. So I think all of us in infectious disease and epidemiology, public health, and particularly in pediatrics, are really, really excited for the news today. Of course, we want to see the full data set. We want FDA to review it. The other important thing I think everyone should realize is that safety never stops. With all vaccines, data are collected for the life of the vaccine. In the case of COVID vaccines, they're examined in almost constant real time by CDC and FDA. So even though things look very safe now, that doesn't mean that vigilance is going to stop. So let me stop there and take questions.
If you have a question, you can unmute or you could ask it in the chat.
Hey, this is Jordan Burroughs. Sorry about that. Can you guys hear me? Jordan Burroughs with Channel 4. You guys hear me okay?
Yes, we can hear you.
Hey, thanks for hopping on today. I appreciate that. Just like with the COVID vaccine for adults, there was vaccine hesitancy. I think in Utah, it's no secret that the hesitancy with kids' vaccines is a little bit higher than the norm. What is health departments and stuff like yourself, what are you doing to try to prevent that and let people know that these stats are true and what you're doing is going to be good for not just your children, but for the community as a whole?
This is a really important issue. we have to communicate to parents that there are real benefits for their children, there's real benefits for their family, and that there's real benefits for the community. And we need to have that come from trusted sources. For many families, the most trusted source is their doctor, their provider. I think as we move farther into the vaccine rollout, vaccine is going to become available in clinics and doctors' offices, so parents can have one-on-one discussions with their family provider. I think that's going to be really helpful. I think people want to hear messages from people they trust, people who look like them. And the health department is embarked on a really multi-pronged effort to get the message out to communities that may be a little bit more vaccine hesitant, minority communities, those that have a history of vaccine reluctance, and to do it through trusted messengers, physicians in those communities. It's not an easy job. There isn't a one size fits all, but we have to keep communicating that this is great news. These are good vaccines. This is a terrible disease. There's lots and lots of benefits to getting your children immunized.
I have a question, Sydney Glenn with Fox 13. How much closer does this get us to normalcy? And also, how long do you think until we could actually, A, see this happen, and B, see this happen with younger kids as well, younger than 12?
So multiple layers to that question. It will get us much closer to normalcy once the vaccine starts getting into the arms of people 12 to 16. That's not going to happen until after the FDA carefully reviews the data and issues an emergency use authorization. I don't have a crystal ball, but I think that's going to be inside of 2 months in all likelihood. Then the issue will be getting vaccine out to people in those age groups. And that's going to take some significant effort because, today we don't have vaccine for everyone who wants it. I think over the summer, things are really going to ramp up. So once we have high rates of vaccination in the general population and teenagers in general, things are going to start to change. For example, school sports have been somewhat risky. I think we've kept them going to some degree, but it will be great to get kids back in the stands at school sports, to have dances again. That can happen when teenagers are fully immunized. So that's the impact, I think, of vaccination for adolescents. Younger children is going to take longer. The Moderna trial has started. I believe that they're almost ready for the first volunteers in Utah under 12 to start getting their vaccine. And throughout the country, Pfizer, with today's announcement, is going to get their trial up and running. But there are more steps in a vaccination study for younger children. Not everyone 6 months to 12 years is the same. So you start with older kids and you ramp down to younger age groups. The other thing that both studies are going to do is they're going to carefully evaluate whether the full adult dose is the right dose or whether children need a smaller dose. So the first step will be to find the right dose. The second step will be to do the older group of children in that age group, say 6 to 11, and then to move down progressively. The best estimates I've seen for vaccine for the younger age groups are somewhere around the end of this year to the beginning of next year. My trusted source is usually Tony Fauci, because he is basically over all of these vaccine efforts and gets to see the data, and he's the smartest person I know. See, Lisa Roche,
Hi.
I think you're asking a
Yes,
question, but you were muted.
I was, thank you. From Deseret News, I'm wondering how this fits in with the vaccinations that kids usually get before the start of the school year. I know there's some issue about getting a COVID-19 vaccine for adults in conjunction with other vaccinations. What should parents be thinking about as they plan their children's health care over the summer for the upcoming school year in terms of fitting this vaccine into whatever other vaccinations they need?
That's a terrific question, and one I think that pediatricians this morning are starting to scratch their heads and figure out how to help with. The recommendation has been to separate COVID-19 vaccines from other vaccines by 14 days, 2 weeks on either side. It's out of an abundance of caution. As of right now, we don't know whether there's any interference between any two vaccines. That's where one vaccine blocks the optimal response to another one. And most of the time, there's no interference, but we're probably not going to know this fall. So what that means is that if you have several vaccinations that are due for your child this summer, perhaps they're getting their 11 to 13-year-old vaccinations and they need 3 different vaccines. They need their HPV, their meningococcus, and their booster for tetanus, diphtheria, and pertussis. You're going to have to think about a couple of visits in order to do that. The other thing to think about is how to stage them. The COVID vaccines, depending which one you get, may require 2 doses. So you're going to have to get your calendar down and probably work with your pediatrician to figure out how to do it best. Now, most kids after about 13 or 14 have finished their preschool vaccinations. So for the older teens, that should be less of a problem. But again, 2 doses 3 weeks or 4 weeks apart is going to require a little bit of planning. I know it would in our family back when our kids were that age.
Quick question for you. Is this vaccine essentially the same as the one for adults than it would be for those 12 to 15?
It's exactly the same. Same dose,
Okay.
same vaccine, essentially the same study protocol.
Awesome. Thank you for answering that. I appreciate it.
And I should add that the side effects are going to be the same. So the side effects are not zero. You need to know that, arms can be quite sore, particularly after the second dose. And a significant minority will have about 1 day of muscle aches, sometimes fever, sometimes fatigue, or joint aches. These are all self-limited. It's overall very safe vaccine. But when you hear that, oh, my kid got the vaccine and he couldn't go to basketball practice the next day, we expect that. That's what we see with a strong immune response. It's what we see in adults as well. And, just expect it. It happens with other vaccines as well.
You mentioned about 29% of Utah's population is under that, 18 age group. Can you talk about why that age group is such a, quote unquote, could be a spreader of COVID-19?
Well, not all children are the same for everything, and that's especially true for COVID-19. The younger children do not seem to get infected at the same rate, and they don't seem to play a really big role in spread. So the fact that we don't have vaccine for kids who are, say, 8 and under, 12 and under is probably not as big a deal. But as you get up into adolescence, into that 12 to 18-year age group, those are the children who have had most of the more severe cases of COVID-19. Those are where most of our hospitalizations have occurred. Those are where the serious complications have occurred. And it's pretty clear from Utah's experience in September, as well as studies around the world, that teenagers do play a role in community-wide spread. That makes good sense. They mix with a lot of people. They have jobs. People come to their sporting events. They're sociable. They breathe and cough at the same rate as adults. And they have a lot of chance to spread among each other. So it's really this group that is now going to be eligible for vaccine in the next couple of months is the group that's really most important to get the vaccine.
Thank you.
Doctor, I'm wondering if you could talk about vaccine availability and how this will impact that. I know we're ramping up supplies, and hopefully everyone who wants a vaccine should be able to get it by maybe early summer adults. But this would just be the Pfizer vaccine available to this age group, correct? And what impact does that have on making sure everyone continues to get vaccine that wants it?
Great question. So Moderna is only a few weeks behind. It's likely, given the speed at which the FDA will carefully review the data, that we won't be actually vaccinating children until probably June at the earliest would be my guess. By then, the projections are that the vaccine supply is going to be pretty robust. So if we have Pfizer vaccine early in June and Moderna later in June or in early July, uh, I, I anticipate we're going to have plenty of vaccine to go around. The challenge, and this reflects on your question earlier, is going to be to get kids in to get vaccinated, both to have parents understand the importance, but also just the practical aspects of getting kids ready for school by getting vaccinated. One part of that, and let me just add this, which I mentioned earlier, the plan all along has been that as we get more vaccine, there will be more and more sites available for vaccination. You know, right now, the pharmacies, many of the hospitals, and of course, mass vaccination clinics run by the health departments are doing the bulk of the work. But the plan all along from the health department has been to get vaccine into the hands of more and more providers as the supplies increase. And that's going to be really important, I think, as we begin to reach out to children, that they have a lot of different places where they can get vaccinated. One issue that I want to bring up is equal access or vaccine equity. You know, it's for some of us, it's a lot easier to take a morning off and bring our kid into our own family doctor than it is for others who may not have the time off, may not have transportation. So one of the challenges that I know the health departments are going to focus on is making sure that kids from all communities have equal access so that there aren't disparities in access to vaccine for children.
Thank you, Dr. Pavia, for answering all these questions. Does anyone have any more questions before we hop off today?
I'm just wondering if you could follow up, Doctor, on something someone said earlier about vaccine hesitancy rates being higher among children than adults in Utah. Is that the case? And are there numbers that back that up? And what's the reason for that?
Yeah. So, you know, when we look at hesitancy about childhood vaccines, Utah is not in any way the worst state in the country, but we do have significant pockets where there's a lot of resistance to vaccinating children. It's generated by a lot of issues, mostly lack of information and, you know, bad information out on the internet. And it's only gotten worse over the last couple of years as we've had, you know, more misinformation and disinformation, more distrust of authority. I think with a new vaccine, that reluctance that parents have to try something new is a very legitimate concern they have. So we have to make sure that information is available, that it's available from trusted sources. And also, very importantly, we have to combat the misinformation. Some of the misinformation is being spread deliberately in an attempt, I think, to generate support for the anti-vaccination movement. And we've even seen reports that there's some disinformation coming from overseas government actors to try and sow confusion. The antidote to disinformation is good information from trusted sources. And that's what we're going to have to apply. And it's not just people like me, because, you know, most people don't know me. I'm not their doctor. It's going to be your family doctor, your nurse practitioner, your pediatrician, you know, people in church leadership, people who you know and trust are going to have to speak out. One thing I should say in terms of trust in vaccine is that for all of these trials, I know so many doctors who have rushed to enroll their kids in the trials. For the Pfizer trial here in Utah, I know a number of families of physicians who enrolled their kids in the trials. For the younger age groups, many of my friends and colleagues have their kids on the waiting list. We believe in this. You know, we put our money, in this case, our kids, where our mouth is. And that should give people some real trust. You know, my kids are not in this age group anymore, but they've been vaccinated. and they didn't need to talk to me. They got it as soon as they were eligible.
Do you know how many Utahns were involved in the Pfizer trial?
I don't, and I
But
don't
there
even
were,
know exactly where to get those data.
okay, I'm sure obviously it might be just private stuff, but do you know, but there were Utahns that did participate. Can you confirm that?
Yeah. There was a site in Utah for this trial for Pfizer. There is a site for the Moderna study of the older teenagers, and there is a site that's going to be opening up or is open for the Moderna study for younger children. It's not associated with the University of Primary Children's, so I don't have a lot of information except knowing that a lot of information is being shared on the Dr. Moms group, because doctors are among the first to want their kids to get vaccinated against COVID-19.
So that's the Pfizer 12 to 15 trial. Utahns did participate in that.
That enrolled kids in Utah, as it did the ongoing Moderna study of teenagers.
Thank you.
If you want to reach out, if you go to clinicaltrials.gov and put in the search engine COVID studies, limit your search age to children, and add the keyword Utah, you'll get the private research groups that did the studies, and they have websites, and maybe they'll be able to provide you some more information.
Great. Thank you very much. Appreciate it.
All right. Well, any more questions? If not, I'll thank y'all. And you know, this is we haven't had that many great days, but the first announcements of vaccine efficacy were a great day for each vaccine, and this is another great day in our battle against this virus.